again, my name is Julia Lodge. I am the pediatric nurse navigator at St. Charles. I am a certified asthma educator. And for the past 12 plus years, I've been supporting children and families with asthma across Central Oregon. And honestly, truly, my passion lies behind helping kids just be kids. Removing barriers related to their asthma so they can run and play and do all the things that they want to do. So I'm excited to be here today and share with you all. Before we get started, I do want to say that this is meant to be a general overview of asthma and wildfire season and should not in any way replace any orders or direction from your child's doctor in regards to their asthma. And if you have specific questions regarding their medication or their treatment, I would encourage you to reach out to your child's medical provider. So, goals for today. The goal when you leave here today is really to understand asthma and its common triggers, to learn how wildfire smoke affects breathing, talk about strategies for keeping asthma under control, managing exposure to wildfire smoke, and really truly to walk away with some practical tools for wildfire season and beyond. So whenever I am meeting with families or doing presentations, I always start here. And I think it's important to have a good understanding of what is asthma. It's hard to fully understand or wrap our heads around it, right? Because we can't see inside of our lungs. So I like to use pictures. And here we have a picture of our airways. So on the left-hand side is a picture of our airway. We breathe in through our nose and mouth, down through our windpipe, and into our lungs. Now we think of our lungs like big balloons, but what's inside of them are our bronchioles or airways, kind of like an upside down tree. And these airways get smaller and smaller and smaller until they're the size of a piece of hair, pretty darn small. And at the end of them is where oxygen gets into our blood and carbon dioxide gets out. Now, important to remember that yes, oxygen is important to breathing, right? Helps us breathe, but also it helps our body function. It's like gas for a car. It helps our brain think, helps our muscles move, helps our body do the things that it needs to do on a daily basis. So if we were to take those airways and make them really big, this is what we'd see. So on the right-hand side, we have our airways. So this top one up here, when I move that arrow, are you able to see it? Yeah, awesome. Okay, so this top one is a healthy airway. So it's nice and smooth and round. We have muscles around the outside of it. They're like rubber bands. This airway is like a nice clean straw, and we can breathe in and out of it nice and easily. The second picture is a picture of someone with asthma. Now this airway, you'll notice it's puffy, swollen. The inside is kind of red and angry looking. This is what we would call an inflamed airway, meaning that it is extra sensitive, twitchy. It's more likely to cough, to have trouble breathing than the healthy airway. And this is probably the most important piece is in my mind when I'm educating families is helping them understand this. I think a lot of times we're really focused on treating the cough and the wheeze and the symptoms. And yes, those can be disruptive. But the reason your child is having those symptoms is because their airway is swollen and inflamed. And it's super important that we're addressing that. And a little bit later on, we're going to talk about how we manage that inflammation. The third airway on the bottom, this is a picture of severe asthma or when an individual is having what we would call an asthma attack. So you'll notice here that the muscles around the outside are squeezing tight. That hole on the inside is really, really small and tight. And also in there, we have some thick and sticky mucus, phlegm. And so as you can imagine, lots of coughing, lots of hard time breathing, maybe sounding wheezy. This is what we want to try and avoid. Before I move forward, I want to pause and see if anyone has any questions about this part.
I don't see anything in the chat yet, but if you wanted to come off mute and ask a question, go ahead and do so.
Okay. So what causes that inflamed airway, right? So there are lots of triggers, a trigger being something that irritates the airways and can cause asthma symptoms. Our most common triggers for children include viral illness, so the cold, common flu, anything that causes a respiratory illness, tobacco smoke exposure, allergies, and then we have weather changes, exercise, extreme emotions, strong smells or odors, and of course, what we're here to talk about today, the wildfire smoke. So specifically, the wildfire smoke, it irritates those lungs and airways because it's made up of these fine particles and gases that can travel super deep into the lungs, causing those airways to become swollen, puffy, inflamed. And important to remind you and tell everyone that really this can affect anyone, even people without asthma. They can develop respiratory symptoms related to the wildfire smoke. But children with asthma tend to be more sensitive because they're still growing and developing. They still have these developing airways. And specifically individuals who have poorly controlled asthma, so meaning they have an ongoing cough. They're coughing multiple times a week. They're needing their rescue inhaler multiple times a week. These individuals are at an increased risk for having more intense smoke-related symptoms. So having an asthma flare-up or exacerbation. So to put that to pictures, we breathe in that wildfire smoke, and again, it causes those airways to become puffy, swollen, and inflamed, make extra mucus, which leads to the breathing symptoms of the coughing, the wheezing, chest tightness, hard time taking a deep breath in, and overall increasing asthma symptoms. So, what can we do about this? So I'm going to cover today kind of two pathways that we can take to manage your child's asthma during wildfire season. The first one being really focused on how we can keep asthma under control, and the second being how we can reduce smoke exposure. So keeping asthma under control. This is probably my favorite soapbox that I talk about all the time with the families that I work with. And really, honestly, truly, the best protection starts before the smoke arrives. The number one goal for asthma management really should be having good asthma control year round. My goal is that children can live cough-free, run, play soccer, sleep all night, and managing their asthma year round so that when they get sick, when the wildfire smoke comes in, when the pollen count goes up, they're able to handle the smoke, handle the illness much better if their asthma is under control and their airway is not puffy, swollen, inflamed before that event even begins. So how we do that, we take medicines as they've been prescribed, as you've been told to take them by your child's doctor. Knowing your child's asthma action plan, which we're going to go into that in more detail here in a few minutes. And then having routine asthma visits with your child's medical provider. Certainly if you're worried or you're feeling like your child's asthma is not under as good of control as that could be, scheduling a visit with your doctor, but also even when things are going well, continuing to have conversations. Every 3 to 6 months, we recommend an asthma-related visit to talk about your child's asthma plan and make any adjustments that we need to before we head into smoke season or before we head into cold and flu season. So understanding your child's asthma medications, this is super, super important. And in most cases, your child probably or should have two different inhalers. The first one being a control medicine. The control medicine is usually an inhaled steroid, and this is something that's taken morning and night every day, no matter how your child is feeling. And the reason we ask you to take that is because its number one job is to get rid of this inflamed airway and help it look like this nice, healthy one. Because again, if we can help your child have healthy airways when it gets smoky out, they are going to tolerate that smoke much, much better. I will tell you that the families that I work with on an ongoing basis who have good control of their child's asthma, when I check in with them during wildfire season, generally they're doing really well because they know their tools, they know how to manage their child's asthma, and they're not having symptoms. The ones that have trouble are the ones that have been having this ongoing cough and aren't getting the support that they need, and their airways are already swollen. And so what we need to make sure we're doing is that we're getting them on the right control medicines to help manage these symptoms. The second type of medicine is the rescue medicine, and this is the one that most people are familiar with. It's usually called albuterol, and this is our quick relief. Its job is really to treat the cough, treat the wheeze, treat the shortness of breath. It's used when the symptoms occur. And though we're not going deep into this specifically today, what I will tell you is that we really don't recommend that individuals with asthma be on just albuterol anymore. So I would, quick plug, if your child only has one inhaler and only has albuterol at home, I would encourage you to call your doctor and set up a visit and talk with them about what you can do to get them on a control medicine to help get their asthma under better control. So the next piece of that is our asthma action plan. And this is what helps make sense of those medicines and how to use them. So this is a plan that your doctor should provide to you when you have those routine visits with them throughout the year. It's a plan that tells you, depending on how your child is feeling, what medicines to give. And if you think of it like a stoplight, okay, so we have green, yellow, and red zones. Green is good. Your child is feeling great. They're breathing easily. They're not coughing. They're not wheezing. They're able to run, play, do all their usual activities. They're sleeping well at night. In that green zone, they're just taking their daily control medicine and they're not needing their rescue medicine. Okay. Yellow zone is our warning zone. This is our caution zone. This is when they first start to notice that they have a bit of a cough or they're having a little bit of trouble breathing. In the yellow zone, they can still do usual activities. They just might need to stop and catch their breath, or they might need to stop and cough and then continue on. They might have some waking up at night or have some poor sleep, waking up more tired than usual. When we're in that yellow zone, we are continuing to take that control medicine because we take that every day, morning and night. I'm going to sound like a broken record. I want you to remember these things. And we're adding in that quick relief, that albuterol medicine. Now, I have lots of parents who ask me, okay, when should I be thinking about starting it? So I hear you say, like, here's the yellow zone. They're starting to cough a little bit, but do they really need it right away, or can I wait until symptoms are a little bit more intense? If we act early, if we act as soon as symptoms start, we end up needing less medicine overall, and a lot of times are able to avoid symptoms from getting worse. So what I usually tell parents is, as soon as it goes into your head of, should I give them their albuterol? The answer is yes. It should always be yes. There's a reason you're wondering that, so just act on it. Honor your intuition. and give that medicine. So anytime a cough is disruptive to their ability to do their usual activities, or if there's any changes in their breathing, I want you to start giving that albuterol. And usually it's dosed where they can take it every 4 hours as needed when they're having an asthma flare. And we expect that when kids are sick or when the air quality is poor or there's a specific reason for their asthma to be acting up, that you might need more of your rescue inhaler. But it helps your child feel better, and then they're able to move through their day. If they're taking their rescue medicine and it's not helping them feel better, or they're needing it more frequently than every 4 hours, it's not lasting them long enough, those are cues that you should be calling your child's doctor. And so again, if you're sitting at home and you're wondering, I wonder if I should call the doctor and talk with them about this. Don't sit and wonder, just pick up the phone and call them and have a discussion. I would rather that you have the support early than try and manage at home alone, and then your child gets really sick and you end up in the hospital. Then we have the red zone. The red zone is our scary zone. This is where there is lots of trouble breathing. So before, right, in the yellow zone, they can do their usual activities. Red zone, they really cannot. They're having a lot of trouble breathing. Their medicine may or may not be really helping them. It's probably wearing off pretty quickly. A lot of times they're not really wanting to talk or move around, or they're needing to take deep breaths in the middle of sentences. So they're not able to speak in complete sentences. Or if it's a little one, they're extra whiny, irritable, clingy. Where we may notice that they are sucking in at their neck or their ribs, any belly breathing, nasal flaring, looking pale, blue, gray around the lips. Any one or two of these symptoms is enough for you to say, I need to take my child to the emergency room. Or you just have that feeling in your gut that something isn't right. And if I don't act, something bad is going to happen. Don't wait around for that bad thing to happen. Take them to the hospital. And usually in this red zone, there's you can take significantly more albuterol. So again, important to make sure that you have had an opportunity to talk through this plan with your doctor. And I'll be sharing also my contact information at the end. I certainly am available to any of you here on the call today. If you have a child that you want more support with their asthma, this is something that I do day in and day out, and you are welcome to reach out. All right. Any questions here? Any questions in the chat at this point?
Yeah, there's no questions in the chat right now.
Okay. I'm going to keep moving forward, but if anyone has questions, please feel free to put them in. I'm always happy to talk through them. And we'll have time at the end as well. Okay. So again, when should I call the doctor? So don't wait for an emergency. I hope that you're hearing that as a big takeaway that I want you to have is, if you're feeling like symptoms are becoming more frequent and they're needing their albuterol inhaler more often, that cough or the symptoms are waking them up at nighttime, I want you to be calling their doctor to have the discussion of, do they need to come in? Do they need to be seen? Do we need to be making any changes to their medicine? If asthma is interfering their sleep, and my rule of thumb, or best practice rule of thumb for asthma management, is that they should have no more than 2 times in a week have any asthma symptoms. I personally feel like that's too much. No more than sleep disruption 2 times in a month. And if those are happening, we need to make sure that they're getting in with their doctor to discuss how to get better control. And certainly, if you have any questions about their medications or their asthma plan, those are reasons to call the doctor. When should I go to the emergency room? This is if you're noticing that your child is struggling to breathe, if, like I said, if they're having any difficulty speaking because of their shortness of breath, if you're seeing any blue or gray around their lips or their fingernails, or, if they wake up in the morning and they're doing okay, and now it's afternoon and they're really struggling, they're having rapidly worsening symptoms, or if they're just not improving with their albuterol. Those are all reasons to go to the emergency room. And I usually recommend that you bypass urgent care for respiratory related reasons, because a lot of times you go to urgent care and your child is having a hard time breathing, they're going to send you to the emergency room. So it'll save you time in the long run by just going to the emergency room at the beginning. Okay. Now we're going to move into the things that we can do to reduce your exposure to that wildfire smoke. So we just did all the things that we can do to manage your asthma. Now let's talk about how we can support your environment. So wildfire smoke is a trigger that you can absolutely manage. But important to know that you can't always tell if the air is unhealthy just by looking outside your window. Sometimes it can look kind of clear, but then you open the door and you go out and you're hit by this wall of smoke, right? And then smoke conditions can really rapidly change throughout the day. I know yesterday, it was pretty good during the day. I went into a workout class and came out an hour later, and all of a sudden it was super smoky. So remembering that those conditions can really drastically change, and they can change quickly. So monitoring air quality really to help make informed decision about outdoor activities. And I think honestly, probably one of the cool things about this presentation today is that the tools and tips that I'm going to share with you now about reducing smoke exposure are not fancy or complicated. They're really small changes that you can make that can make significant improvements to reduce smoke exposure and help your child's breathing and your breathing, right? So monitoring air quality, really knowing before you go. And in this day and age, we all have our smartphones, right? And I think the great thing is that just readily available in our weather apps, we can open it up and it will show us what the air quality is for right now in our area. Other areas that you can go to look for that air quality index, Air Now is a really fantastic website. They have an app, or any other local weather reports or apps generally have this listed there. So the air quality index is a tool that we use that tells us basically how good is the air to breathe right now. Should I be using caution to go outside? And important to know that this is just a tool, and at any point, even if we're kind of in a lower range, if your child is feeling affected by the air, so it's most important to pay attention to how they're feeling, what symptoms they're having, because maybe they notice that they're having symptoms when it's in the yellow zone and it's not even up in the unhealthy zone yet. And so if your child is able to tell you how they're feeling, making sure that you're asking them and having discussion with them about what their breathing is feeling like. So 0 to 50 is generally good. Once we get above 50, we're moving into the moderate zone. And the orange zone is the one that I really want you to cue into. This is the unhealthy for sensitive groups. And anyone with a chronic health condition is considered a sensitive group, and asthma is absolutely considered that unhealthy for sensitive group zone. So really, honestly, 100 and above, we should be pausing and thinking about whether we can adjust our plan for the day or avoid going outside and doing any strenuous activities. Also, using your asthma action plan to adjust medications depending on if your child is having any increase in symptoms. They may need a little extra of their rescue inhaler or sometimes of their control inhaler when they're having those increased symptoms. So when that air quality is unhealthy, obviously, we want to do our best to stay indoors when possible, keeping windows and doors closed and really limiting that strenuous outdoor activity. If you have to go outside, maybe we're not running around crazy or doing activities that cause us to breathe really deeply, right? So we're going to modify, or if we can, postpone outdoor activities. If you do have to go outside, I would recommend pre-medicating with albuterol before you go outside. This will help prepare your child's airways so they can tolerate that smoke exposure for that short period of time. So like if you have to go run errands and go to the grocery store or do things that, that's just, you have to do it. Just thinking ahead and doing what we can to set your child up for success. And then again, talking with your doctor about whether you should be doing any adjusting to asthma medications when the air quality is poor. So then when we're indoors, we want to think about things that we can do to keep that indoor air as clean as possible. So again, keeping those windows and doors closed, using air conditioning and recirculation when available, and creating a designated clean air room. So this is a room ideally that doesn't have any outside doors that you can keep closed, set up your air purifiers, and really have a clean space for your child to be in. So thinking about playrooms, certainly bedrooms, areas that we can keep more airtight so that they're breathing good, clean air. So portable air purifiers. And quick side note, I am by no means an expert in this area. If you want specific details of like what specific air purifier is recommended or specific filters, I provided a link at the end of the presentation for the EPA website where you can go and get a little bit more detail. But generally speaking, looking for HEPA air purifiers or high efficiency filtration purifiers. And then super important to choose one that's the right size for your room. So usually on the air purifier, it will say it's good for, this many square feet of a room. And so having something that fits the correct size of your room is going to provide better coverage, better air cleaning for that space. And then your HVAC filters. So changing the filters in your home air conditioning and heating units is super important. So checking them frequently during smoke events and replacing them when you're dirty. And so I know we live busy lives, and if you're like me, it's something that's like out of sight, out of mind. But when our air quality gets poor, it is super important to make sure that we're pulling those out and checking them and replacing them. And using the highest filter that's compatible with your system. We usually recommend the rating is a MERV 13 or higher. And again, if you want more specific details, I would recommend checking out the EPA website for more recommendations. So then the other thing to think about is not adding more to the air. Now, there's a lot of things that we do that we don't realize that might actually be polluting the air inside our home. And so doing your best really to avoid the following. So as always, no smoking or vaping in the home. Never recommend that you do that, but especially now. But also avoiding candles and incense because they put fumes and perfumes and scents into our environment that can exacerbate or worsen your child's asthma symptoms. Cooking fumes, so making sure that you have You're using your ventilation when you're cooking, especially if there's extra smoke. Any strong fragrances or aerosol sprays. So thinking about our cleaning supplies, beauty supplies, avoiding using those, especially around your child. So not using those in their clean air room for sure. And then fireplaces and wood stoves, probably this time of year during wildfire season, we're not using fireplaces. But something to think about if you were just thinking about avoiding opening and bringing any extra smoke into the room while your child is in there. And then dusting and vacuuming, especially if your vacuum doesn't have a great filter on it, any dusting or sweeping is going to kick up dust into the room and can cause extra kind of pollutants in the air. And so maybe doing that when your child is napping and not in the room, or other times when your child can be away from that dust. So to kind of wrap it all up and tie it with a bow, breathing easier this wildfire season really is about keeping asthma under control year round, right? Having good ongoing conversations with your child's doctor to manage their symptoms and have them on the right medicines, reducing smoke exposure and knowing when to get help. Being prepared, staying informed so that you can breathe easier and so your child can run and play and just be a kid. So here are our resources, and feel free to, when you guys post this on your website or if you send a follow-up email, to send those out. And with that,
okay, if we share the slide deck.
Oh yeah,
okay,
that's
great. So yeah, we'll send a follow-up email tomorrow with these links and with the information in the slide deck.
Perfect. So with that, any questions? Don't be shy. I always tell families there are no silly questions.
If you have a question, you can come off mute and ask it.
I have a question.
Yeah.
What levels, is there like a set level for the schools that they follow that they do not or should not let the kids out, like for recess when it's really smoky?
That is a great question. And I feel like I have this discussion with families and even with schools every year. I would have to do some research and get back to you, but certainly in the unhealthy zone, they should be not going outside. Really, I think if it's unhealthy for sensitive groups, if your child has asthma, I would have a plan with the school nurse, with the teachers, for having an alternative for your child to stay inside when it's in the orange zone or higher.
Thank you.
Yeah. And I do a lot of partnering with our school nurses in the region as well. So that is part of the support that I provide.
I do believe Crook County does I think it's 150 when they start making them stay inside.
Okay. Thanks, Rebecca.